This is post-treatment, and it was very simple, very straightforward. We simply had him hug his right knee to the outside of his shoulder. Can you demonstrate that for us? It was little uncomfortable. We did it for 3 minutes, given his it's a new movement for that hip, right? When was the last time you did this with your hip?
No, not
right, never.
Never.
Yeah. So this is angled outward to the outside of the shoulder, and he did that for 3 minutes. So go ahead and set your leg down. And I was very surprised at the mobility that we gained. I thought I would have to treat the sacrum separately, but in a little while we'll show you. So now I can take up slack, and now I can spring it and get some recoil. And it's subtle. It's not normal movement yet. It's not what I would, hope to ultimately achieve with you. I think we can get some more movement than that. But I can take up the slack, and now I can bounce, and there's a recoil. And let's have you lie on your stomach. So earlier we didn't have any inferior glide mobility. I can take up the slack. I can see your feet move. And then I can spring, and there's movement and recoil, and when I let go there's a final recoil. What really surprised me though was with that simple treatment on both sides, his sacrum, the bottom of the sacrum, the apex, is now a little bit lower than his PSIS. And I'm going to take up the slack and spring it. And there is a little bit of backward bending mobility in his sacrum. The sacrotuberous ligament, I can indent it slightly. I would still describe it as being quite tight. So we still have work to do in trying to gain normal mobility. And I'm doing a lateral spring test. And I think that in the next day or two, we will gain additional mobility and get some additional softening of the sacrotuberous ligaments. But we're off to a good start. If you gained this with 3 minutes of a stretch on both sides, is certainly encouraging. And what I would like to do now is have you walk up and down the hall and give us some feedback.
All right. Whoa.
You made a noise. What was that about?
Yeah, my legs feel a little bit foreign to me, I suppose.
Your legs feel foreign to you?
Yeah, they do actually. I feel a bit jelly-legged.
Jelly-legged?
Yeah.
Keep going.
Go.
You have more arm swing than you had before.
Whoa. Yeah, I can't describe it. Things have changed, that's for sure.
How so?
Yeah, just freer movement.
Freer. Okay,
Freer.
that's a real positive. I'll take that.
Absolutely.
Yeah, go one more time.
Okay.
And this is a pretty rigid trunk, given that part of his thoracic spine is fused. That stands to reason that that's what we would see. So any other comments?
Just freer, more mobile. And
Uh-huh.
just feels less tension around my pelvis area in general.
Okay, let's have you backward bend. That was quite stiff. Your thoughts?
Yep, definitely a little bit more movement there.
Okay, I'm curious to look at hip extension. Let's have you lie on your stomach. And that was 10 degrees before on each side. So I'll keep filming, but I have to set the camera down. And that's definitely freer.
Wow.
That is definitely 15 or more degrees of hip extension. So I think we're off to a good start. One of your big concerns was your pelvic hypomobility.
Yep.
And I think to that I think it's going to alter your hip mechanics, the femoroacetabular joint. I think the contact area is going to change slightly with this change in orientation of the pelvis. And I'm pleased. I think we're off to a good start.
Mate.
And again, this is mobility-based model more so than position. You know, we could have named it and said, oh, you have a right anterior ilium. No, not true. You had an anterior ilium on the right that was greater, but you had one on the left as well. That was what the movement evaluation told us. And it told us that you didn't have mobility in the opposite direction, and that your sacrum had forward bending mobility, but it did not have backward bending mobility. And the posture of the sacrum and the posture of the pelvis was revealing. But more so than posture is the passive movement testing that guides my treatment. And this is day 1. We did some things with your left subtalar joint. It lacked abduction and eversion, and we restored that motion passively. I'll teach you how to keep that tomorrow.
Yes, please.
Your right knee, you had a meniscectomy, and you lacked external rotation of the tibia, and we improved that, and then we got up to the pelvis. I'm really pleased that you had this reflex gain, or biomechanical gain of hip extension without me actually directly treating hip extension, which tells me, had I tried to gain hip extension directly to the hip, I would have failed. In my opinion, it would not have been lasting even if we made a short-term gain, because that was driven more by the lack of pelvic mobility. And, there's certainly a lot of controversy out there, and you get on the internet and people say, oh, posture's not relevant, and, and you can't test movement of the SI. And I submit that posture is one picture. And with the picture of your posture, you had an anterior tilt on both sides. Mm-hmm. Looking at you from the side, the ASIS much lower than the PSIS. And the posture showed us the sacrum was prominent on the apex, but the mobility testing taught us, and I don't claim to isolate movement inside the SI joint. I claim to be able to test movement that goes through the SI joint. And sometimes the restrictor is outside of the joint. It's not necessarily a malposition of ilium on sacrum. If it is, I can't measure that in the clinic. No one has those tools. Even with imaging, you have to implant titanium balls into the sacrum and ilium, a process called stereophotogrammetry that, that's the only way to tell, do we have movement. External pelvic markers tell us very little. They don't tell us about what's happening inside the sacroiliac joint. Some people have drank that Kool-Aid and believe it can. It's not true. But again, I think this is a pragmatic model. And I think in your situation, I think it's going to help you, especially given the limited hip mobility that you have, and with that, the restricted pelvic mobility. So this is day 1, and we've been 2 hours now, and we've gotten only up to the sacrum, feet to sacrum. So tomorrow we'll pay more attention to the rest of the body. And we'll continue trying to enhance mobility in the pelvis. Any comments? We also gave you a 1/4-inch heel lift.
Any comments? No, I'm just trying to get this all through my head. It's fantastic already.
Good, good.
I feel $1,000,000.
Very good. Well, I'll stop filming now. And thanks for letting me film. And I'm okay to post this on YouTube?
Absolutely.
Good.
Yeah.
I think we kept your face out of it, but... if not, you're not bad looking. You'll do. You're okay.
All good. I'm not ashamed.
There you go. Thanks so much.
Thank you.